In relation to that, I think a letter was sent out in December 2021, effectively reminding every household that they should continue to access NHS services if they needed them, despite, for example, some concerns about protecting the NHS, etc. Do you know if that letter was sent out in accessible formats for disabled people?
Forgive me, I don't know. I'd be astonished if it wasn't set out in accessible formats and also in various languages as well. But I would have to look back to give you an answer with absolute certainty, and I can obviously provide the inquiry with a certain answer in writing if so wish.
And thank you. And my last question is just this, that my clients have a concern that disabled people in particular may have been the ones who were less likely or unable to access hospital treatment unrelated to COVID-19 during the pandemic. Do you know if any evaluation was done of the Right Care, Right Place programme to see how it impacted on disabled people, positively or negatively, I should say?
There was absolutely evaluation done of that campaign. And highlighting some of the successes, but also where we can improve upon the campaign. Again, you will forgive me if I can't recall whether the evaluation looked specifically at the issue of those with disabilities and with accessibility issues. So again, if it so pleases the inquiry, I can ensure that a written response is provided.
Thank you very much, Mr. Yousaf. I'm most grateful for the indulgence, my lady.
Thank you, Mr. Burton. Ms. Jeane.
Thank you, my lady. My lady, I'm pleased to say that in light of the evidence given, I only need to cover one of the two topics I've been given permission on. Mr. Yousaf, I appear on behalf of the long COVID groups, and I want to pick up on the interactions you mentioned having with Long COVID Kids Scotland. Firstly, some points of simple chronology, which I hope we can take quite quickly. It's right, isn't it, that in those meetings with Long COVID Kids Scotland, the first of which was in November 2021, the parents and carers of children with long COVID shared their concerns with you of being disbelieved by medical professionals, of delays in obtaining a diagnosis, of being refused referrals to specialists, and of the absence of accurate public information on the risk of long COVID to children and young people. That's right, isn't it?
Yes, and I should start my responses again to re-emphasise and put on the record just how valuable those interactions with long COVID representatives of those lived experience were to me, both as Health Secretary and I know continue to be to my colleagues who have succeeded me thereafter.
And taking that chronology a bit further, in June 2022, you also met with several of the children themselves, and saw firsthand previously healthy children who had become disabled by long COVID. And at that time, you made a very public promise to continue to raise awareness of long COVID in children. Is that right?
Yes. Mm-hmm.
And it wasn't until a year later, April 2023, that the Strategic Networks Children and Young People's Group met for the first time. And as Caroline Lamb has told us, it's only now, in the summer of 2024, after your tenure, that one clinical pathway for children and young people in one NHS board has been published. Caroline Lamb, in her evidence to the inquiry, accepted that there was a delay in Scotland responding to the needs of children and young people with long COVID. Ms. Yousaf, do you agree that there was a delay?
Yes, I've already accepted that in my exchange with Ms. Price, that there could have acted with greater speed, and there was often reasons why that wasn't always possible. And again, the exchange with Ms. Price, I mentioned in reference to the fact that winter 21-22 was extremely difficult for NHS. But no, I accept fully the criticism and critique from those with experiencing the long-term effects of COVID, that they felt that the government just didn't move at a quick enough pace, and that's something we've got to reflect on.
So looking back at what happened, the first infections were in 2020. You first met with the families of children and young people with long COVID in autumn of 2021, yet by early 2024, my clients' children still had no access to specialist long COVID care, which left one parent with no alternative but to pursue legal action against their NHS board. So, Mr. Yousaf, my question is, why wasn't more done to ensure that children and young people with long COVID could access care before you left your role? the debilitating impact on children should have prompted more urgent action, shouldn't it, notwithstanding other demands on the healthcare system?
So where I perhaps differ from the characterisation is the suggestion that virtually nothing was done in that intervening period. So you're absolutely correct to state when the meetings took place, you're absolutely correct to state when the first pathway came into being in existence. But of course, the message to our health boards at a local level was, one, the funding was available and existed. You have to do an investigation of where the gaps exist. And although there might not be, for example, one single pathway, there should be services available, rehabilitation services available where necessary for young people and children that are suffering the long-term effects of COVID. I fully accept the criticism that long COVID kids have made, that there was not enough public communication around the pathways that existed, and that they felt that it takes too long to access some of those services. And I know those are some of the challenges that my successors and colleagues are still continue to work on to this day. But a suggestion that there was nothing effectively done until summer 2024, I would suggest is somewhat unfair.
Ms Yousaf, the reality is that in the summer of 2024, as Ms Caroline Lamb has told us quite clearly, the first and only clinical pathway for long COVID with children and young people was published. So prior to now, my clients have had no access to care. I note the points you make about communication, etc. That's not what my question is. My question is in relation to the provision of care for children and young people whom you met, who have become newly disabled by long COVID. Why wasn't more done before you left your role?
Well, again, I think there was, if not clinical pathways, I accept clinical pathway being established in summer 2024. There would have been, for example, there could have been referrals made by GPs when they first saw a young child that was presenting with the long-term effects of COVID to particular rehabilitation services, to particular services within the local health board area. What government did, what I did, was to ensure for the first time that there was funding available to local health boards, so that when they investigated the gaps that existed, that funding would be available not just for 1 year, because services can always fall over after 1 year, given if they are not funded for longer. The funding provided and guaranteed for 3 financial years was to ensure I would hope at least a step in the right direction. The criticism from long COVID kids, who I think are an exceptional organisation, doing an important amount of work, is that there are not enough clinical pathways. There needs to be further investment, and there needs to be a better communication and consistency across the country. I think are ones that government must reflect on, and I hope we can give long COVID kids and children more reassurance than they perhaps have at the moment.
And finally,
Thank you, Ms Inga. That's as far as we're going to go, I'm afraid.
Thank you.
Thank you very much indeed, Mr Yousaf. You've helped me once before. I've no idea whether we're going to have to ask you to help us again. But in the meantime, thank you for the help you've given so far. And I hope that the current bout of snow isn't too disruptive in Scotland. I think it's been pretty disruptive, as you'd expect, in England. But there we go. You're more used to it than we are, I think.
No, thank you, and I'm just pleased I'm not Transport Secretary when the snow falls, I have to say. But no, thank you very much, my lady, and of course I'll always make myself available should you require in future modules.
Thank you very much. 10 o'clock tomorrow, please.
All rise.